Now, Good Morning Washington.
I mean, everyone is guilty of trying to self-diagnose a cough, fever, even the chills. You hit up WebMD or something, but do you really know what to look out for? We've got Dr. Ken Redcross here with us to help us differentiate the difference between the flu and the common cold, and to share a few pointers to beat these viruses this winter season. Thanks for coming in.
Thank you for having me, Julie.
I know, I joke, his last name really is Redcross. When I first read, I thought he was from the Red Cross, but that's not true.
Like them, I am fine with taking donations, Julie. I have no problem with that. Look, the big key, I'm glad you're having me on today because it was important to come and talk about becoming virus vigilant.
Yeah.
So right now we're in the throes of the flu season, but it's important for us to understand that there's some other viruses out there as well that can mimic the flu and that they can also present with fever.
Yeah.
So it's even more important, especially now that we're in D.C., to talk about the financial impact of the flu, right? It usually is about $87 billion on our economy. It also results in about 30 million patient visits to my office and doctors' offices all across the United States. So it's important that we don't let our hair down just because now we've gotten through New Year and through Christmas, because the flu can actually go all the way out into May. So make sure that we're still very vigilant when we do that. Now, it's important to get to your doctor's office within the first 48 hours because in that window, there are some things that we can actually write with our prescription pad. But it's tough, Jumi, because lots of times we don't know whether we have a cold or whether we have a flu.
Right.
So it's important to, if you don't get in, think of something like homeopathic ingredients like oscillococcinum. See, oscillococcinum has been shown to decrease both the severity and the duration of flu-like symptoms when taken within the first 24 hours. Not only that, oscillococcinum is great for kids 2 years of age and older. So there are some things out there. The other thing that's important is vitamin D. We know now that if we're deficient in vitamin D, we may be more susceptible to the flu as well. So consider making sure that vitamin D is a part of what you're doing as well.
Yeah, I know we can get the vitamin D at our local drugstore. Same with the, I can't even.
Oscillococcinum. Yeah, you have to say it over and over. Oscillococcinum, oscillococcinum. Yeah, you can actually get that at many pharmacies, grocery stores as well. And I love it because I like to stay closer to the earth, Jumi, when I'm talking with patients.
Yeah.
Because I'm not a big medication guy if we don't need it. So oscillococcinum has a space for that.
And that was going to be my question. You know, a lot of times people try not to take medicine. They think, oh, I have a cold. I'll just drink fluids, rest, and it'll knock out. But when do you know when, okay, I might need to go see a doctor and get maybe some antibiotics or something?
Well, okay, so as we'll talk about a couple of these other viruses, antibiotics don't have a place here. Antibiotics are only for bacteria, okay?
Oh, bacteria, okay.
Only bacteria. So when we talk about viruses, it is about supportive care. So some of the liquids and so forth that you've talked about. But the difference tends to be, think about a cold as more upper respiratory, stuffy nose, maybe, you know, kind of runny, teary eyes. Think about the flu as feeling like you got hit by a Mack truck. It's those body aches that clue me into the fact that you may be dealing with a little bit more, especially after a couple of days or so. But once again, influenza is the most common player this time of year. But there's also another virus that you don't think you've heard about, but you have whenever it shuts down cruise ships and shuts down daycare centers.
Norovirus?
The norovirus. Ding, 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 ding. You get a point for that one. Because that's key. And so the important thing when you're thinking about the norovirus is that you want to make sure that you're washing your hands. Mom always says, wash your hands. Sing happy birthday to me. That's about how long you need to really wash your hands to get the virions off your hands. The other thing is I wanted to make sure I brought 2 ways to hydrate because everyone says, Dr. Redcross, I hate water. I don't want to drink water. So I said, what about coconut water?
Okay.
Coconut water is great. It's flavored nowadays and it has a lot of electrolytes. The other virus we should talk about is from my home state in New York. It's called the Coxsackie virus from Coxsackie, New York.
Oh, okay.
And over there, that causes the hand, foot, and mouth disease. That's usually a disease that you see in kids 10 years of age and younger. You cause a rash around the hands, the foot, and the mouth. But the key here is that you want to make sure that you're managing the fever because the fever is the hallmark of disease with the Coxsackie virus here. And so when you do that, you can do that whether you're making sure you check your temperature and making sure you're also lowering your temperature externally, cool washcloths and that sort of thing.
Okay. Real quick before we let you go, just some like myths, maybe facts, old wives' tale. Today it's in the 60s. This weekend it's going to snow. When the temperature fluctuates, do people get sick more?
You still do. You can still get sick even with the temperature because don't forget the flu comes in a wave. And so even though the weather's out, don't be fooled. Remember, we're talking virus vigilance, so you have to stay on top of all this.
Okay. And then last question, can you starve out your fever?
No and yes. Actually, you could do a little bit of both.
Okay.
It depends because, you know, mom always says what? You always make sure that you feed a cold and you starve a fever, right?
Yeah.
And so you have to do a little bit of that depending on your symptoms, right? Because when you're talking about the norovirus, you're talking about vomiting and diarrhea where hydration is important. And then when you're talking about something like the Coxsackie virus, it's self-limited. It gets better on its own. The last part I want to make sure, consider your flu shot this year. I am a natural doc, okay? So I don't get them every year, but this year it's a good one. It's about 70% benefit there.
Okay. Dr. Redcross, not from the Red Cross. Thank you for coming in.
Thank
Great
you for having me.
information.